as well as green stick fracture, because they are very, very important fractures. Means practically it is very common to have these kind of fractures in day-to-day practice. Next, 78 year. Now we are talking, or we are about to talk the fractures in the distal aspect of the radius. That means articular part of the radius. So we are talking about a sample question. I am explaining you a sample question which is considered to be a non-specific type of question having a exactly specific answer. 78-year-old female who has sustained injury to her right wrist with a visible deformity. What is the diagnosis? Now, just try to understand the essence of the question. All right. Now, they have just mentioned the age and you came to know that it is the fracture of the elderly. Now, she has sustained injury to her right wrist. Now, in the wrist, there are multiple bones which are packed or clumped together. But in the question, it is only mentioned the fracture of the injury to the wrist. So, somewhere the fracture has been happened. It could be in the radius, it could be there in the ulna, it could be in the carpal bones, or it could be in the base of the metacarpals also. So, somewhere around the wrist, the fracture has happened. With a visible deformity, they have not even specifically mentioned that what kind of a deformity the patient is having, but they are seeking for a specific answer. All right. That is the essence of the question that you have to remember. So, the topic that we are about to start is the Colles fracture. Answer for the question was Colles, and you will come to know why you have to mark the word Colles fracture for that particular question. Now, before we talk anything related to the management of this Colles fracture, it is important to have the diagnosis of the Colles fracture. So, what exactly is Colles fracture? It is the extra-articular fracture of the distal radius at corticocancellous junction. Now, just try to understand what is the meaning of these statements. Imagine this is the distal end of the radius. This is distal end of the ulna. So, we are talking about the extra-articular. That means without the involvement of the joint surfaces, extra-articular fracture, distal radius at corticocancellous junction, because this is the cancellous region and this is the cortical region of the bone, at corticocancellous junction, but with dorsal displacement. This is the definition. With dorsal displacement. What do you mean by the term dorsal displacement? Imagine if we look at the fractures of the distal end of the radius in a lateral view, or Colles fracture in a lateral view. So, the displaced fracture, the distal fracture is, or the distal fragment is dorsally displaced. So, these are the carpal bones and these are the metacarpal bones. Alright. So, the distal fragment is dorsally displaced. This is the defining criteria for Colles fracture. So, at this point of time, you came to know about the complete definition, that it is the extraarticular fracture of distal radius at corticocancellous junction with dorsal displacement. Point number 2, elderly female. You see, almost all the time, because the bones are too weak, and these are the females which are likely to get or sustain injury just after getting slipped in the washroom or the bathroom, after getting slipped in 2 of the stairs or from 2 of the stairs. All right. That means a low velocity trauma where the impact is in, where she tried to support the body by the placement of the hand onto a rigid object. It has resulted in the fracture at the weakest junction in the upper limb, that is at the corticocancellous junction of the distal end of the radius. So, elderly female. Every time you see a Colles fracture in your emergency, in the OPDs, it is going to be in the elderly females more commonly. Then the deformity. Now, just try to understand. It is not very difficult to understand. If we go back to the same image, if we are having a dorsal displacement of the distal end of the radius, then what will happen to the skin above it? The skin above it will be having a step. This is how the skin will be visible, having a visible step, visible deformity. And all of us have seen a dinner fork from the lateral aspect. Now, this is how the dinner fork, lateral aspect, there will be elevation. And this elevation means obviously it is there to put the index finger on this elevation in order to stabilize this dinner fork. And that is the reason why it is called as the dinner fork deformity. The name of the deformity is dinner fork deformity. Alright. Then the displacements. Now, what are the possible displacements the patient with the Colles fracture can have? So, under the heading of displacements, the first one which you already are aware of is the dorsal one, because out of dorsal and ventral, it has to get displaced dorsally. Then only the definition of the Colles fracture would be justified. Second is lateral. Out of mediolateral, lateral is far more common. And the third one is impaction or attrition. We have already discussed these kind of displacements when we were talking about supracondylar fracture of the humerus. In supracondylar fracture of the humerus, there was posterior, the medial as well as medial rotation. Here it is dorsal, lateral with impaction or attrition. So these are the displacements which are common with the Colles fracture. So it is dorsal, impaction, lateral tilt or the lateral shift. Then, so this was about the introductory part of the Colles fracture. So this is how you will identify a Colles fracture. Now, if I go back to the question again, now in this question, although it is non-specific, 78-year-old female, that means elderly female, injury to her wrist, because Colles fracture is so common that every time elderly female comes to you with the injury around the wrist joint, you make the diagnosis of Colles just without looking at the x-rays also. X-rays are required for management as well as confirming your diagnosis with a visible deformity, and the deformity obviously is going to be a dinner fork kind of the deformity. Alright, what is the diagnosis for this condition? Answer for that question is Colles. So it is a non-specific question asking for specific answers. Next, what is the management? Now, examiner has recently asked about the management also, and it is true that Colles fracture which is happening in case of elderly is a very common phenomenon you will observe in day-to-day practice. It might happen in any of your relatives also, and you should be able to manage the condition so that there is no further complication that can happen without the management. All right, or you can arrest the possibility of a complication that can happen in future. So what is the management protocol for this? In order to manage it, what you have to do, first of all, you have to de-impact the fracture fragments. That is achieved by traction. After applying the traction, you have to correct the dorsal tilt, which is corrected by flexion of the wrist. Then you have to correct the lateral shift, which is corrected by ulnar deviation of the wrist. All right. So this is how you will apply the cast, and then you will immobilize it. Once the fracture is reduced, it is found to be stably held, then you will put it inside the cast. So that is the management protocol. So management is, or the treatment is, closed reduction and Colles cast application. Closed reduction and Colles cast application. Now all of you came to know what is closed reduction, that you have de-impacted it by the placement of the traction. So what are the steps in closed reduction? You have to apply traction. Then after application of the traction, you have to go for flexion of the wrist. Then after flexion, you have to go for ulnar deviation. Alright. Once the fracture is reduced, then you have to immobilize it by the placement of the cast. Now that is achieved by Colles cast. So what exactly are going to be the specifications in Colles cast? It is not very difficult to understand now. In Colles cast, the wrist is immobilized in. Wrist is going to be immobilized in pronation, then flexion and ulnar deviation. And one more important thing that you have to remember is that the Colles cast is a below elbow cast. Elbow is not immobilized in this. It is a below elbow cast. And once you have applied a Colles cast, alright, once there is application of the Colles cast, it will take up the shape of a shaking hand. And that is the reason why it is called by the name of hand shaking cast. This is why it is called by the name of hand shaking cast. So hopefully you have understood everything related to the management also. It is achieved by closed reduction and Colles cast application. You are asked to identify the Colles cast on the pictures also. You have been asked about the management of the Colles fracture also by the placement of the traction and flexion ulnar deviation. That means the steps. And you have to identify the Colles cast in the form of a hand shaking cast. Alright, that is a synonym which is given to this Colles cast. Next, what are the possible complications which are associated with this Colles cast? As far as the x-rays, now before we come to the complication, this is the x-ray of a Colles fracture. As far as the x-rays are concerned, they are not going to give you the isolated x-ray. It will always be assisted by a theory. And in the theory, keywords are to be given. Those keywords are elderly female, low velocity trauma, sustained injury to her wrist, When you see these three terms in your question, then jump onto the diagnosis of Colles fracture or consider it to be a Colles fracture until proved otherwise. All right. So what are the possible complications of Colles fracture? Now, you see, every time the patient comes to you with a Colles fracture and you have managed it after reducing it by the placement of a cast, that cast is applied for the period of 1 month. That means 4 weeks. After 1 month, you remove the cast and you ask the patient to make the joint mobile. Now, at that time, there will be a loss of mobility of the joint. The joint will become stiff, and that is the most common complication associated with either treated or neglected Colles fracture, that is stiffness. So, stiffness of the wrist is the most common complication. It will happen. It will happen for a persistent period of time in case of neglected or complicated fractures. It will happen for some duration of time in case of perfectly reduced and managed fracture, but it will happen in all the patients. Stiffness. Then, if you have to consider one complication related to the union, then it has to be malunion or non-union, because the fracture is happening at the corticocancellous junction. That means involving the more porous side of the bone, more vascular side of the bone. So the possibility of union are higher. So yes, malunion is a commoner complication. Then the third one is, one tendon is found to be ruptured more commonly in comparison to all the other tendon associated with this Colles fracture. What is the name of that tendon? Now, based on the discussion that we had, it is very easy for us or you to diagnose what is the name of the tendon, to come up with the answer. It has to be extensor or flexor tendon. It has to be extensor. Why? Because the distal fragment is displaced, extensive means dorsally. So it has to be extensor. Then that extensor tendon has to be there on the radial or the medial side, because this is a fracture of the radius. It has to be there on the radial side. So there will be a rupture of extensor carpi radialis longus muscle. All right. So extensor carpi radialis longus tendon rupture is a common complication associated with Colles. Then, because if the fracture has malunited, or it might result in the associated injuries around the wrist leading to the compression of a median nerve under the flexor retinaculum, might also result in carpal tunnel syndrome. And finally, reflex sympathetic dystrophy or complex regional painful syndrome type 1 is very commonly associated with these, where the nature of the pain is beyond the nature of disease. That means the patient is experiencing more pain, more deformity, is experiencing more difficulty, all right, in comparison to the nature of the condition, all right. And this is also seen in almost all the patients who have suffered a Colles fracture. So reflex sympathetic dystrophy, or nowadays a better term is used for these unknown painful conditions, that is complex regional pain or painful syndromes. All right. So it is CRPS, that means complex regional painful syndrome type 1. So these are the complications associated with Colles fracture. Remember, stiffness, malunion, one tendon, then there is a carpal tunnel syndrome which can happen, and the nature of the pain beyond the nature of the condition. The patient is experiencing more pain in comparison to what she had been subjected to. So this much you need to remember about the Colles fracture. That means if you divide the Colles fracture related topic, you divide it into 3. The first one is identification. Identification will be based on definition, will be based on x-rays, will be based on deformity. Second is management, that is closed reduction and Colles cast application. The third one is the complication. So this is how you read and learn about the Colles fracture. Every year you are getting a question related to Colles fracture, because the examiner wants you to identify and manage with lesser possibility of complications related to this fracture, so that there is a less burden on the running orthopedic OPD, all right, or the emergencies. Hopefully you have understood everything related to this very important topic, that is Colles. Now next is Smith fracture. Now exactly opposite to the Colles in terms of displacement is a Smith fracture. That means if I define a Smith fracture,